How do STI co-infections affect health? Imagine dealing with more than one health issue at the same time. When it comes to sexually transmitted infections, having more than one at once can make things much more complicated. That's what we call co-infections. They happen when someone is infected with 2 or more STIs simultaneously. Co-infections are quite common, especially among groups with higher risk, like men who have sex with men, people living with HIV, or those with multiple partners. Having multiple infections can make health problems worse. For example, if someone has both chlamydia and gonorrhea, each infection can be harder to treat and more likely to cause complications. In women, untreated chlamydia or gonorrhea can lead to pelvic inflammatory disease, which might cause chronic pelvic pain, ectopic pregnancy, or infertility. Men can develop epididymitis, which can also lead to infertility if not treated. Certain STIs, especially those that cause sores or inflammation like syphilis, herpes, or chancroid, increase the risk of HIV transmission. When these infections occur together, they can create a perfect storm, making it easier for HIV to enter the body during sex. This means co-infections can raise the chance of spreading or catching HIV, which is a serious concern. Diagnosing and treating multiple STIs at once can be tricky. Symptoms of different infections often overlap or hide each other, which can delay diagnosis. If a healthcare provider only tests for one infection, they might miss others, leading to ongoing health risks. Plus, co-infections can put extra stress on the immune system, especially if HIV is involved, making it harder for the body to fight off other illnesses and potentially worsening overall health. Research shows that people with early syphilis often also have other bacterial STIs like chlamydia or gonorrhea. For example, among HIV-positive men who have sex with men, high rates of chlamydia and gonorrhea co-infections are common, especially in those with recent hepatitis C or syphilis. This highlights the importance of comprehensive testing when one STI is diagnosed. If these infections are left untreated, the consequences can be severe and sometimes irreversible. Scar tissue from infections like chlamydia and gonorrhea can block fallopian tubes in women or sperm ducts in men, leading to infertility. Chronic pelvic pain can develop from pelvic inflammatory disease. Pregnancies can be complicated by increased risks of ectopic pregnancy or miscarriage, and babies can be infected during childbirth. Some STIs like human papillomavirus are linked to cancers of the cervix, anus, and throat. Because many STIs do not show symptoms, regular screening is essential, especially for those at higher risk. Early detection and treatment can prevent most long-term health problems caused by co-infections. If you test positive for one STI, your healthcare provider should check for others, since co-infections are common. In summary, STI co-infections are quite common and can lead to worse health outcomes. They increase the risk of infertility, chronic pain, and HIV transmission. The best way to protect your health is through regular testing, prompt treatment, and using protection like condoms. If you're concerned about STIs or your sexual health, talk to a healthcare professional for personalized advice. Remember, taking care of your sexual health is an important step toward a healthier life.